The California Occupational Safety and Health Standards Board has determined that the safety of dental personnel is supposed to be protected by OSHA law.
I'm concerned about allegations that an employer group in the state of California is not aware of or not actively pursuing following regulations that may exist in the state of California that apply to them. I'm concerned in general that an employer may not disclose to their employees the nature of chemicals that those employees may be exposed to and the hazards that are associated with them consistent with California regulations. I'm concerned that an employer may choose to engage in practices that expose their employees to higher levels of those chemicals than are fit and or that meet the standards for the state. And I'm concerned about allegations of an employer failing to be aware of or know what exposures their employees are facing in the workplace.
Good morning, Chairman McLeod, members of the board. My name is Teresa Bechet. I'm with the California Dental Association.
Okay, thank you. Any questions?
My first question is, there was one of the previous speakers made the statement that dental offices have been discouraged by the CDA and the ADA, I guess it would be, from having monitoring devices and or monitoring for chemicals. Is there any truth to that?
That is incorrect. If you go to our website, cda.org, there's a tab that says Advocacy and the Law. Go down to Regulations, go down to Regulatory Compliance. We have a section on occupational safety and health and infection control. There is information on formaldehyde, nitrous oxide, and glutaraldehyde. Those are the chemicals that we at CDA get the most questions about from dental offices. As a matter of fact, my job at CDA includes taking those calls from dental office staff on regulatory compliance issues.
The various statements that have been made concerning lack of knowledge about OSHA regulations that would apply to the workplace, is it your experience that dentists in the state of California are not aware of the OSHA regulations that apply to their workplace?
I write columns on regulatory compliance for our newsletter. You could take a look at our website and see the vast amount of information. We have several links to Cal OSHA websites.
Is HAZCOM included within that training?
For some of them, they are. The emphasis, of course, has been on bloodborne pathogens. HAZCOM training is provided by some. CDA hires the lecturers, but we don't give them the material. They're the ones who develop their own course.
Does CDA get involved, recognizing that many of the dental employers in the state of California are small employers who may not have the resources or knowledge necessary to do things like industrial hygiene monitoring within their workplace? Does your trade association get involved in assisting and facilitating gathering of data that would be helpful and explaining what methods may be necessary in order to control exposures that may occur in the workplace?
We did that most recently with the glutaraldehyde issue. In general, we have discouraged the use of glutaraldehyde in the office.
Well, moving back to Mercury, have you
Yeah.
done any monitoring on Mercury and on that side of this puzzle?
Frankly, the monitoring on the Mercury, it hasn't come up on our radar. I mean, they claim that the science has been there, but there's not a splash made. There isn't warning, there aren't warning signs, there aren't cases. It just hasn't come up. And I've been with CDA for 13 years. I'm not aware that there were workers' comp cases. CDA as a professional association has relationships with professional liability insurance companies, workers' comp companies.
And you've actually looked at it, it's not aware of any cases?
I haven't asked our workers' comp company directly, but it certainly hasn't been raised. And something like that would have been brought forward, especially since folks know what I do in the office.
So that's a no.
That's a no.
In March, the topic of Mercury came up.
Yes.
It would seem to me that in 4 months you've had a chance to do some sampling and testing so that you can come back and tell us what results you did find.
I guess we would see doing the sampling and testing more of a role. I would have to go back and we would have to get permission. We're not a private company where we could just go to the workplace and do it. We would have to ask our members if they would be willing to do this. So,
And I'm certain there's at least one that would permit you to do that.
probably. But the use of amalgam has also decreased significantly over the years. So, you know, designing that type of sample is really dependent on the patient caseload for the day. Are you going to measure on a day where there's only one patient who may get an amalgam? Or a day when there are going to be lots of patients getting an amalgam? I mean, it's really, how do you design, how will you do that? I mean, with glutaraldehyde, you know, you're sterilizing instruments, and that's fairly even. But as we found with the wastewater issue, your patient caseload for the day impacts the measurements you are taking.
This is why we would expect you to use a certified industrial hygienist who will establish the protocol for the testing.
Absolutely.
And when it comes to sampling for a ceiling, one test is all you need.
And that's what we do with glutaraldehyde.
The concerns that have been raised, in my mind, are largely enforcement issues. All we are doing is restating the same rules. I am concerned that the associations that deal with the dental industry need to be making certain that their employer members are aware of the standards that they're expected to comply with in California. It should not be an optional element that one thinks about. This is a necessary part of doing business in California. If dentists are not aware of the expectations that are upon them for dealing with the hazardous materials in the workplace, that's not so wonderful. That would imply a breakdown of the training and of the education that's going on. That the industry and the public and the employee health are all best served at this time if the trade associations associated with the dental industry make certain that the regulations that exist are understood by the dentists and the employers in their industry. It's incumbent on the division, the enforcement unit of the division, to assure that those regulations are being complied with. And that, to me, if there are issues here, that's where that needs to be addressed, making certain that we're enforcing the regulations that exist at the moment. I'm not certain that's being done either. That's beyond my purview. It's incumbent on the employers who are asking their employees to do the work to make certain the work is being done safely. The regulations are intended to give guidance about that. But ultimately, the responsibility lies with the employer to make certain it's done. And that's the way we work in California, and that's the way we work in the United States. And that's really the way it should be. You guys know what you're doing. You know your business. It's expected that you know how to do your business safely.
I want to echo what Dr. Frisch said about what appears to be purely an enforcement problem. It's not a problem of not having well enough established regulations, but regulations about monitoring exposure levels, engineering controls, personal protective equipment, even hazard communication. If enforced, would seem to have made some of these alleged problems go away. We should enforce the rule we have. Affected employees who believe that their employer is in violation of the regulation should pick up the phone and call the enforcement unit and have Cal OSHA determine whether or not there is compliance. It happens pretty well in almost all the other industries in California. A complaint moves to the top of the list. This I know. We should step up and say, enforce the rules.
If you feel that you've been exposed to mercury without your permission, contact the number on the screen.